And welcome to Urban Institute's event on Are Kids Getting Shortchanged in the Federal Budget? I'm Gene Sturley, Richard Fisher Chair here at the Urban Institute, and I'm honored to be able to moderate this event with many of my co-authors on this report, as well as an illustrious panel that we have with us here. The event is being webcast. So if you're watching online and would like to submit any questions to the panel, you could do so by emailing events@urban.org. And whether you're in the room or joining us by webcast, you can also join the conversation on social media by using the hashtag #live@urban. That's #live@urban. So we're here in part today because of the publication that has just come out of the 12th edition of KidShare. This is KidShare 2018. Now you might wonder why we started doing this and produce an annual report. Well, about 12 years ago, we discovered there really was no accounting for what children were getting in the budget. So a lot of debates were taking place on children's programs, but they were taking place without the full context of how they related to each other and just what was going on. We thought that was something that needed rectifying. And so why might you want to know what's going on as a whole? Why might you want to do the budget accounting, even though you may not have performance measures for everything you're accounting for? Well, it's sort of like knowing that you're taking a drug without knowing what the other drugs are. If you want to make prescriptions for the future, you really want to know what's in the budget as a whole. And in some sense, this is no different than why we prepare a budget as a whole for the federal budget. We want to know how all programs are operating. And so we obviously want to know how all programs are operating for children. In the process, we decided we didn't just want to do a partial accounting. As I say, we wanted to do a more full accounting. We also wanted to see the problem in the light of how press coverage might cover something. Take the recent debate that came about because of the Council of Economic Advisors report that's now raised this big issue on how you measure poverty and what programs for poverty are doing for people. Well, you can't really engage that debate, and I would say a lot of the popular press does not engage it well if you don't think about what the total budget for poverty programs are as well. So what did we do in this report? Well, one thing we decided to do was try to make an annual update. Well, why do an annual update? I'm reminded a little bit about the child who came home from his first day at school, and the parents asked, "What did you learn today?" And he said, "Well, not enough. I have to go back tomorrow." So I think it's actually true that every year we learn something new about how things are changing. And it's not just changing because of the political dynamic, it's also changing because of what's going on with the economy and what's going on with the direction, as you'll see when Heather, my colleague, presents the report, what's going on in programs in general, independently of new legislation. So with that little background here, I'd like to introduce Heather Hahn, who is going to, in fact, give us some highlights from the report. Heather co-leads the Urban Institute's KidShare project, as well as its From Safety Net to Solid Ground initiative. She has 2 decades of experience conducting nonpartisan research on the well-being of children and families and the programs that affect it. So Heather, if you'll lead us off.
Hello, thank you for being here. So as Gene said, we're here because of this new report, the KidShare 2018, which is the 12th report in our annual KidShare series. How the government spends money reflects our priorities, so we do think it's important to be taking a close look at this. And annual monitoring, like Gene said, we do this every year, but this annual monitoring of the tax expenditures and outlays allows us to track things over time and project out for what we think will happen in the future based on our best current knowledge. This report really plays an important role in informing decisions and discussions about the federal budget, about priorities, about the broad budget decisions, as well as decisions about spending on children. The goal of this report, actually, I'm going to put the next. There we go. You can see the report up there. The goal of the KidShare series is not to say this is the right amount of money or how much would be the right amount of money, but rather to provide the detailed information that's needed to inform those debates and discussions so that others can talk about what are the implications, like we're going to have in the discussion today. So we hope that KidShare 2018 will continue to focus attention on this vital matter. My co-authors are Julia Isaacs, Carrie Liu, myself, Ashley Hong, Caleb Quakenbush, Jean Sturley, and our funders, the Annie Casey Foundation is the longtime funder of the KidShare work, and we're very grateful for that. And we're also grateful now to have support from the Peter G. Peterson Foundation as well. So what is the KidShare of the federal budget? In 2017, about 9% of the federal budget was spent on children. The federal government spent overall $3.9 trillion, and $375 billion of that went to support children. As you can see on the chart, almost half of the federal budget was spent on retirement and health benefits through Social Security, Medicare, and Medicaid. And we have 15% spent on defense, 7% spent on the interest on the debt, which we will come back to, and then the remaining quarter of the budget is for everything else that the federal government spends money on. So parents and families are really important and provide the most support for children, obviously, but public expenditures also play a vital role. They help children receive the resources they need to reach their full potential. They provide food, shelter, good health, education, equality of opportunity. So with that context, it's useful to know that the share that we spend on children is shrinking. The KidShare of the budget has been relatively small over time. So on this chart, the pink at the bottom is the spending on children. And you can see, and it goes from 1960 through 2017 and then projections to 2028. And that KidShare has been relatively small since 1960, which is as far back as we are looking. It hit a high of 10.7% in 2010. And is projected to decrease going forward. So under current law, as I said, the current share of the KidShare budget is 9.4%, and that is projected to drop to 6.9% in 2028. So this figure also allows us to clearly see the budgetary pressures that are squeezing the children's spending. And if we look at this chart closely, if you look between 2017 and 2028, the only sections that are growing are the Social Security, Medicare, and Medicaid for adults, and interest payments on the debt. And so far, we've been talking about federal outlays, but a comprehensive picture of spending also looks at the tax benefits for families. So in addition to the $375 billion in outlays on children in 2017, there was $106 billion in tax reductions targeted to families with children. So these are the reductions in tax liabilities and the revenue losses to the government from tax exclusions, from deductions, and from tax credits that aren't paid out as refunds. When you take all those tax provisions together, the tax provisions benefiting children far exceed any other major category of spending on children. The largest child-related tax provisions are the Earned Income Tax Credit, which is $60 billion, the Child Tax Credit, which is $49 billion, and the Dependent Exemption, which is $38 billion. So after that top long bar on tax provisions, the next largest categories of spending are health and nutrition. And Medicaid is the single largest program supporting children. We estimate that there was $90 billion in Medicaid spending on children in 2017, which is about a quarter of all Medicaid spending is going to children. What you can also see in this figure is that some of the best-known children's programs, like classic programs like Head Start, account for only a small share of the federal spending on children. So when we think about spending on children, taxes and Medicaid are probably not the first things that come to mind, but that is where the bulk of the federal spending on children is going. And 2/3 of public spending on children comes from state and local governments. And that means that where you live matters. So state and local governments contributed 65% of total spending on children in 2015. So for state and local figures, 2015 is the most recent complete data that we have. And as you can see, most of the spending goes toward public education. So the black sections up here are state and local spending. The blue is federal spending. So when you look at total public spending on children, most of it is coming from states and localities for education. States and localities also spend money on children's health, income security, child care, and other investments, but not as much as the federal government in those other areas. And if we want to look at dollars per child, on average, the federal government spent $4,811 per child, while states and localities spent $8,888. So $4,800 from the federal government, more than $8,800 from states and localities. And this 8,888 figure is the average across the states, but it's really important to keep in mind that that spending varies greatly by states. So kids see different levels of investment in their education and their well-being depending on where they live. So looking back at just the federal spending now, this chart shows that the federal government will soon be spending more on interest payments on the debt than on children. And we saw in that initial pie chart that currently we're spending more on children, but in 2020, we expect those lines to cross. Now this chart zooms out a bit from that one. Now down at the bottom is the interest and the children. And we put this in the context of total outlays and revenues, because one of the reasons that interest payments will be exceeding spending on children is that federal outlays are projected to exceed revenues every year between 2017 and 2027, as they have since 2001. So as spending exceeds revenue every year, the federal debt rises. Because of that higher national debt and rising interest rates, interest payments on the debt will double by 2028, or projected to double by 2028, and exceed spending on children by 2020. The other thing to notice in this chart is that outlays bar is still rising. So over the next 10 years, total federal spending is projected to increase, but almost all of that growth is going toward health and retirement programs for adults and interest payments on the debt. And so for children, only 1 cent of each dollar is going to children, and the children's share of the budget overall is projected to fall. So this is important to keep in mind, because as we know, public and private investments in today's children have far-reaching consequences for the future. What we invest today will have effects on tomorrow's workforce, economy, education, criminal justice, and health systems. So I've only touched on some of the highlights from our KidShare 2018 chart book, but I encourage you to peruse the full chart book for additional information on children, as well as the broad trends in federal spending, both currently and over time. So now we're going to have the pleasure of listening to our panelists have a discussion about these findings and the larger context in which they exist. And I'm really looking forward to that panel discussion. So if the speakers could please come to the stage. And as a reminder, people watching the webcast can email questions to events@urban.org. And everyone here and online is welcome to tweet at #live@urban.
So as I mentioned at the beginning, I'm really honored to be moderating this illustrious panel. I've known most of the people on the panel for a long time, and I've worked with all of the organizations for even longer time. To my immediate left is Karen Howard, who's the Vice President for Early Childhood Policy at First Focus. She's worked with Congress for a long time. She understands how Congress works. She knows what's going on in the Hill. And she has a deep programmatic. How about that? Anybody miss out on what I said? So as I was starting to introduce the panelists, to my immediate left, I can move the mic up a little. Hi, go there. Is Karen Howard, who's Vice President for Early Childhood Policy at First Focus. And as I said, she has a deep background and understanding of what goes on in Congress and the Hill. She's worked on a lot of the various programs, and she's brought that program knowledge to First Focus. I should say also that we've had a long relationship with First Focus as well in terms of reports we produce at the same time, often are different times, but often on the budget for children, which has been an emphasis in both of our workings. To her immediate left is Maya McGinnis, who's president for the Committee on Responsible Federal Budget. I think most people know Maya well from her days on TV and news, and also just her great presentations and testimonies. Her research shows the growing constraints on the federal budget as a whole, and how the budget process could be improved to better address national priorities. Maya has one weakness. She has a board member by the name of Gene Sterling, but outside of that, I don't know that people would comment on too many other things. Immediately to her left is my colleague, Julie Isaacs, who's a senior fellow here at the Urban Institute. She co-leads the KidShare project and has done this for a number of years now. She brings expert budget analysis from her days at the Congressional Budget Office, and she has long-standing research on government programs serving low-income children and families. And last but certainly not least, and to my far left is Samantha Vargas Papi, who's the Director of Policy Analysis Center at Unidos US. She's an advocate's perspective on many of these issues, especially for Latino and immigrant children and families. And I think many of you will also know her well from her many writings and presentations. So we're going to go through a series of questions and let the panelists answer them. The first question, we'll let all the panelists speak, but after that, we'll have a little more of a free-for-all. So we have a very good group of people to talk on these issues, and they're very polite to each other, so we'll all get everybody to talk. And Maya, so I think I'm going to start with you on the first question, which is give us just your first reactions to the report, and particularly from your perspective and background.
Okay, I will. First, I will say thank you very much to Jean and Urban and all the authors of this report. This is a great report, and it is a report that we've been doing work on. Can you hear this? It's like echoing 3 times in my own ears. Okay. We've been doing a whole series on kids in the budget because it's really important that we take the budget, which is a dry, dull topic, and try to make it more about values and national objectives. And this report over the years has just been kind of the cornerstone for us relying on it. So thank you for a great report. But then more personally, for all the young people in the audience, if you ever want to figure out the best way to figure out what your career should look like, here's my piece of advice, which is you pick your role model. And so for me, I picked Gene Sterling. He doesn't know I'm going to tell this story. And out of the blue, called him up. I was in my 20s, and I was like, I want to have a career like yours. Because he was the person I most admired, singularly, from sort of his principled, policy-based. I couldn't tell what his politics were. I didn't care. It didn't seem to be what was driving him. And he was nice enough to take me out to lunch and kind of go through how he became Gene Sterling. So I recommend to everybody that you...
What was the answer? Never mind. we have to get on the report.
Yeah, no, anybody, I mean, and it doesn't, you don't all have to call Gene. You can pick other people. But it was a really nice thing to do to somebody as I was starting my policy career, and it made a huge difference. So Gene is my policy idol. So what I think about this is I think kids, again, the budget itself and all the fiscal challenges we have as a country are so dry, are so difficult to connect to people's lives that it's a big threat in so many ways in the economy, but it's very hard to get people to care about it. And I think the role that kids play in the budget actually illustrates so many of the shortcomings that we have with the budget right now. And I think the budget illustrates so many of the shortcomings that we have with our overall ability to govern right now. But if you look at it, the underinvestment in kids and the declining investment in kids, in my mind, shows how much more we focus on the immediate than the long term. And that is a recipe for disaster for your economy and for the quality of your country. It shows how we focus on consumption so much more than investment. And it shows how we skew hard choices, in that the easiest thing is to keep the budget on automatic pilot in so many ways that it is right now, and not look at not only the great research and returns that you get on investments in children, but the changing needs, and I'll talk about more of this as we go on, but when you look into the future, where the economy is headed, what do we know we need? It is a well-equipped, healthy, trained, competitive workforce, starting at the earliest ages and moving throughout life. The world is going to change so dramatically like we've never experienced. The pace of change will be so fast. And if we're not equipping the next generation to be prepared for that, it is a recipe for failure and what's going to be a much more competitive environment. So I just think the work that KidShare has done, and we're trying to piggyback on this and really highlight this issue, exemplifies why it's so important that we change the overall fiscal policy, both in terms of not raking up a huge amount of more trillions of debt for our children, but also the way that we divide our resources. So thank you guys for highlighting all of the important stuff that comes through this report.
Thank you. Karen, you want to go next?
I want to echo that. This report is so helpful because I think the public does not know that we underinvest in children, and members of Congress may not know. And so this report is really useful. I know.
Look at that. I was the only one who got it right so far. They're very complicated.
Okay, thank you. Hopefully, is that better?
No.
We also have a budget book at First Focus. I think we use the same methodology. And it really, it goes into a little bit more detail into the programs, but the overall theme is much the same. There's been a real disinvestment in children, not just this year, but over the last decade. And it makes it harder for our work because we know the problems that, I'm so sorry. I'm a loud talker, though.
I think it does.
Okay. The problems for children, they're 24% of the population, but 33% of the population that is poor. Childhood homelessness is going up. Children are faring really not well at all in the federal budget and not well at all across the nation. And so the more we can amplify what is going on and also what the implications are. There's one stat that really stood out, and that is the children's share of the budget is projected to drop from 9.4%, which is abysmal, to 6.9%. That's 25% over 10 years. That is a huge decrease in funding and has real implications for our future, for our economic security. And so we're really, unless we course correct quite quickly, I think we're going to really reach a critical point for children in our future. So.
You can hang on to that, I think.
Okay.
The rest of the mics might work. Samantha, you want to go next?
I'll start by echoing my fellow panelists. Thank you to the Urban Institute for creating this wonderful resource. It's wonderful yet sobering every year as we see the trends continuing, right? I can't underscore the value of a nonpartisan, fact-based, in-depth analysis of this type of issue. I agree with Karen. I think a lot of people, advocates, researchers, people on the Hill, take for granted that there is an investment in children. And yet it takes reports like this and other people to lift up and make sure that that perspective and the truth is really lifted up. At Unidos US, for those of you who don't know our group, we are formerly the National Council of La Raza. Advocacy on the federal budget has always been a big part of our economic policy portfolio because we understand the importance and how this touches programs that help lift millions of Latino and Latino children out of poverty every year. The reality of poverty in our community is sobering, where we reached an all-time low for children in poverty in 2016, yet 26.6% of Latino children lived in poverty. So these programs that help working families when wages aren't enough or times are tough, and of course have an effect on the stability of the home and the environment in which a child is raised, are tremendously important to us. This report, of course, has such a wealth of key takeaways. It's hard to just distill down to a few. But of course, the one that's always shocking is the continued divestment in children's programs, not only continued, but projected to continue to decrease. And you know, what Maya sort of really hit on a point that I took away from this was that you know, the further decline of investment in children really underscores for me in the advocacy and policy advocacy field that I not only have to have a focus on the short-term advocacy, you know, to go out and advocate for a fair and inclusive federal budget each fiscal year, but also to keep sight of investments in an agenda that will really help provide opportunity to all children, no matter where they live, who their parents are, where they're from, to make sure that they have that opportunity to succeed.
Julia?
Well, let's hope my microphone is working. I'm going to copy Maya and go and add a personal story of when I was in my early 20s. And the person I spoke to was my mother. But I said, so I was like very interested in math and adding things up because I just like things to make sense. Like you can't say 2 + 2 = 5. I mean, you can say it, but it's not. But I also love children. I was the oldest child. I had a baby granddaughter born 2 weeks ago. I love children, and you look at those children, you want them to grow into their human potential. And how could I combine a career that was very math and my love for children? And she suggested public policy school, and here I am. So my reactions to this report, of course, as an author of the report, and I worked on it when I was at Brookings and actually came to Urban partly so I could continue working on it. I think what's challenging is that there are people who work on the budget, and they often aren't thinking about children's programs, and there are people who work on children's programs, and they're trying to make sure there's enough money for Head Start and early childhood, which I work on, is very important, but aren't aware how much comes through the tax programs and through Medicaid. So I guess my reaction is if you have to sort of think about tax policy and broad budget reform if you want to be thinking about the well-being of kids in the future.
Very good. So let's get a little more into the nitty-gritty of what's going on today. So the report reports a lot about trends, both from the past and into the future. And I'm just curious whether any of you, and we'll take you in any order you want, or anybody speak up when you like to. You all don't have to react. But how do you see this relating to what's going on legislatively? Do you see anything legislatively that's going to take us off the paths that Heather laid out in her introduction?
Where do you want us to start?
Anyone, whoever wants.
So I'll start. So projecting is always hard. We know that. You project the best way that you can, and I think the projections that the share of the budget that goes to children is going to decline is probably optimistic, given two main things. One, that does not seem to be the priority of either party right now in terms of major investments, where sort of the middle class, you think we're coming, everybody's thinking about 2020 already, broad themes for winning elections are there. Children is more of a niche issue, and when you're thinking about presidential elections, you're thinking about broad-based groups of people, demographics, and the middle class is usually where the focus will be. And again, that's this huge mistake, because what the theme of anybody who's thinking about becoming a lawmaker should be is how do you invest for a thriving economy? There's so many things we can fight about. Republicans and Democrats can fight about how big the government's going to be, how things are going to be divided. But a growing economy and a competitive workforce are sort of unable to be taken by one party or the other, so that should be a clear theme. But I don't believe it will be. So I worry about that. But more specifically, I worry about the obvious fiscal situation that we're facing. So there is a fiscal vice that is going to squeeze everything that can be squeezed. And the things that are less immediate and have a weaker constituency will continue to be squeezed. We have seen that to our own detriment of how we set up our budget. But we are going to hit trillion-dollar deficits in just over a year. Our debt is going to reach 100% of the size of the economy in about a decade. Interest is the fastest growing part of the budget, and as was mentioned, interest is going to be larger than how much we spend on kids in no time, in just a couple of years. But that vice means there's going to be very little room for new things, new spending, plussing up on the investments where we should be. And the ongoing promise of I'm not going to touch any of these big behemoths, whether it's Social Security or Medicare or the biggest tax expenditures, which we should be looking at reforming, means there's going to be very little resources that are freed up. So I think that situation is very troubling and bodes for more dire numbers than you already see in the projections. I hope somebody else has a much happier take.
Well, yeah, I'm afraid. I was speaking to a reporter yesterday about this report, and they talked about, well, this decline in children, is this related to the proposed cuts in the safety net? And I said, oh, well, this is actually current law. This decline you're seeing is assuming that we don't make changes. And yes, if we made, and I'm particularly concerned about the Farm Bill, having worked on food stamps. If we were to cut food stamps, 44% of the people on food stamps are children, and another, I've forgotten if it's 30 or 40% are the adults living with those children. So I don't have something more optimistic in terms of I'm not seeing legislation that would increase spending on children. I'm seeing legislation that would cut the safety net. And since so many, as we've mentioned, so many of the poor people are children, cuts to the safety net are cuts to spending on children.
I wanted to say I don't think there's anything legislatively that's going to change this, but I'm hoping that elections change this, because elections have consequences. And I'm comforted a little bit by the kids in Florida at Stoneman Douglas who took to the streets and are, demanding sensible gun control. I am encouraged by the teachers in Arizona and West Virginia and Kentucky, states which have reduced spending on education and reduced taxes. And they took it upon themselves to really take to the streets and demand action. And so I am hoping that with more information to the public, with folks like you, that folks can start to say no more, that this can't happen anymore and we need to turn this around for our future. So while I don't think it's going to happen legislatively, I think it's going to have to be an outside force. And I'm hoping that will come for children. So that's
I think we're probably in the boat where legislatively, I don't think we will see anything that will improve the situation and the projections. I remain concerned that we might see some changes that actually make those projections worse than they are, given where we're seeing a lot of the responsibility for reducing the deficit really falls on those who have the least. I mean, right now in the appropriations process, we are seeing a lot of proposals that propose to cut programs, not only cut programs, but there are other attacks to try to weaken and undermine programs by adding work requirements, changing the funding structure of programs that will really make it hard for people who depend on those. A lot of children whose livelihood depends on those, food on the table, roof over heads, will be affected negatively. So we would like to see a shift where a budget does require everyone to pay their fair share, including, a lot of folks who got a major tax cut and added to that deficit. And we're asking just so much from those who have the least.
By the way, again, feel free to comment on each other's comments too. Again, we don't have to do in any particular order as we go along. How about relating your last comments to both what I call the micro and the macro aspect of what's going on? So, for instance, Maya, you mentioned several of you mentioned the word investment, about cutting back on investment. So at the micro level, there's some concern about what we're doing to individual families and children, but I wonder if this actually might not be large enough, given the numbers, that it has a macro effect, that it's actually affecting, or it is related to a potential slowdown or actual slowdown in our growth rates over time if we're not, for instance, investing in human capital. So was one data point, for instance, and this is closely related to the projections that Heather gave you. It looks like revenues will rise 10 years from now, if we take Congressional Budget Office assumptions, by about $800 billion. I may have the number quite not quite right. I've got to adjust for the recent tax cuts. And then you ask, that's real revenues. That's $7,000 per household additional we have to spend on different things. And if you have the other numbers and you ask, well, how much of that $7,000 per household is committed? The item she mentioned is mainly retirement, health, and interest on the debt. It's 150%, which then relates to the comments of the panelists that something's going to get squeezed. So I'm just trying to figure out how we can relate for the public this micro aspect of what we're doing to families and children with the macro question of what's going on in the economy. And maybe things that you actually see from your own work or your own working with people.
Well, I think child poverty has a cost, right? I've seen studies that it costs $600 billion a year in lost human capital and expenditures for juvenile justice, health disparities, education disparities. And I think there's going to come a point where, you talked about, Maya, investments in the future, economic security, children to pay into Social Security so that we keep going. There's going to be a time where that's going to be impacted. And I'm reminded, I can't remember who said this, they said there's no economic security for the grays, older white men, unless there's economic mobility for the browns. And I think we're all in this together, but we don't necessarily see that. And so since we're all inextricably intertwined in this, I think that we're going to see an impact. And I don't know when, but it seems based on these numbers fairly soon.
Here's a problem I think we have, which is there's been a whole lot of discussion recently about economic growth, and the president has promised repeatedly that his policies are going to have dramatic increases on economic growth, which is probably true in the very, very short term. We've just kind of overstimulated the economy during a period of growth with a lot of deficit financing. That will grow the economy sort of by quarters and a couple years, but not in a more long, sustained way. But I think it will actually have a damaging effect in a longer way because this stimulus that happened was deficit financed. The debt is larger. That slows your economic growth. But there is more of a pronounced focus and discussion about how to grow the economy more, both because the president's used the bully pulpit to talk about it, but also we face a major slowdown in the economy driven by the change in demographics. If your economic growth comes from productivity growth and labor market growth, when you have the baby boomers moving into retirement, that's obviously going to have a much lower contribution to growth. So that's pretty certain. There's not a lot of uncertainty around those projections. The challenge that we have here is we know that public investment, there are a lot of things that help grow the economy. Smart tax reform, smart regulatory reform, public investments, a lower level of debt. The problem that we have when linking these two issues, I think, is that the investment in kids is a longer-term play. Now, a longer-term play is exactly what we need here. In some ways, there's the Joint Select Committee is this group that's working right now in Congress on budget process reforms, and we have a bunch of kind of things that we think about and would like to see change in how we do budgeting. One is to focus more on the long term. And there's a challenge there, which is every year you project out, your projections become less reliable. But if you're not looking at the effects of something in the longer term, you are exacerbating the existing political incentive to focus on the very short term. So the fact that investments in kids isn't going to pay off in 18 months, nor should we expect it to, will be seen as a shortcoming if you have an administration that's like, how do I grow the economy for 2019 and 2020? Whereas it would be huge if we could say, let's even look at second decade effects, not just first year effects. So all of that goes to a topic that Jean knows very well too, but how we structure our budget and think about it, and what Jean was just saying, look at how much additional resources we have in the next 10 years, then let's think about how to allocate it. And what I'm saying, which is let's look at the returns on something out over the longer term to incentivize us to make longer incentives. Those dry, boring budget process changes are really going to be necessary to change the lens that we think about these things and put a little bit more advantage into longer term investments like that in the next generation.
That's a great point, Maya. I think a lot of times the children's programs get caught up, right, in this we need a tremendous investment now, but aren't going to see an immediate payoff. But we know from the research that Karen mentioned, that there's a tremendous cost to poverty to the economy. In our work and in our community, a lot of the research that we do, a lot of other research that our partners do, we can see the very real contribution that the Latino community has today and in the future, not only in terms of, backfilling the labor markets, entrepreneurship, tax contributions, and we know because of changing demographics, those contributions are going to become even more crucial to support the economy of the future. Children's programs support a lot of our community, but something you said earlier was that the constituency with a least voice really kind of loses out in fiscal policy, and we know kids can't vote, kids can't lobby, and so it really is up to us to really lift up that voice and help make known that these investments really do have an impact not only on children, not only on communities of color, but the national economy, and make that connection more clear.
Well, maybe I'll try to do what Karen did and make sure it's not all negative. So we are projecting declining investments in children, but there were some increasing ones during the 90s and in. So if you think of this, the two generation, if you think of the 20-year lag, whatever generations are, some of the children who are in their early 20s today may have been growing up at a time when we were starting to invest more, and more in early childhood, which is one of the areas that, when you look at the effects on economic growth, seem to be the most well documented. So some ray of positivity.
Actually, the CEA report, although it argued both sides of this question, but it actually did make very positive statements about the EITC and its positive effects on children.
Yeah, and
that was one of the ones that grew.
Yeah, so if you think of, Heather said the three largest were Medicaid, earned income tax credit, and child tax credit. And certainly the earned income tax credit, many people see as having done, that its growth is very positive for people, supporting low-income families, but also supporting work. And certainly Medicaid, the way Medicaid has expanded in the last 20 years is something that there are a lot of children covered now who weren't covered 20 years ago.
Jean, what you just said made me think of something, which is it is really important to have high levels of analysis and scrutiny on the returns on investments, because we all tend to, for the areas that we care about, sort of act like everything's a huge payoff and there's no poorly spent resources. And if there's one thing we know, it is going to be a tighter fiscal environment. The fact that we are projected to go into unprecedented fiscal territory means things will change. They will be forced on us to have to look at how to change our budget. And one thing that's important is to actually take seriously the responsibility to look at how kids programs, not every single one is the highest return, not every single one is perfect, we can improve them, and to be willing to look at that budget from that critical eye too. The problem is, if you are an advocate for children's spending, you need to know that all the other advocates are doing the same. Are we holding farm spending to the same level of scrutiny and military spending to the same level of scrutiny? So, I believe that the budget really needs it's going to need adjustments on all sides. We shouldn't be making quote-unquote investments when they're not. We shouldn't be overselling the benefits of things. But you want to make sure that there's a level playing field in terms of that evaluation.
Go ahead.
I was just going to ask, may I ask a question of my fellow panelists, and just following up, right? And that we're talking about, really a values-based conversation around how we prioritize and value our children. And yet, a lot of times, right, in talking about the budget, we're talking about the return and the investment and all of these in very economic terms. Part of my fear, and I see the value in doing that, but that in this current environment, we see a lot of sort of dehumanizing of children and of families who need these programs. How do we balance, leading with those values, but also making known the economic, macroeconomic effects?
So this raises the question of what evidence do we have? How good is the evidence we have right now? As Heather laid out, this report is not about what evidence we have, for the most part, on children. Where's our evidence best? in terms of deciphering among these programs.
But I thought you
Let
were
me
going
just-
to answer. I thought
But I
now
wanna
we
go-
changed the moderator, and now you're answering. You're throwing back more questions.
I'm just reiterating the question.
I want to go back to what you said because I also, and I may have not done it, I always like to say that there's more than one reason we want to spend money on children. And one is because we want to be supported when we retire one day. We want economic growth and all that. But the first reason, I hope, is because, well, there's many reasons, but we may care about equality of opportunity. And that's one thing federal spending does, which is different than economic growth. I mean, you want equality of opportunity and economic growth are both goods. And then there's just, I mean, you don't want to see children not getting what they need to grow to their human potential just for your own humanitarian reasons or values as well as economic reasons. So I appreciate your saying that.
I agree. But
I wanted to comment on what Maya said about evidence, because in the early childhood space, that was the avenue in which we thought we could get new investments, new federal money into these programs, right? We know the brain science, we know the return on investment, we know that the interventions work. And so that was a hook. And I will say, because I know Julie has been involved in the federal home visiting program, which is the maternal, infant, and early childhood home visiting program, MCV is what it's called. That really, you know, we got a sizable investment for home visiting, a federal funding stream for evidence-based home visiting, largely based on the evidence of these programs. But really, when we looked at the renewal of the program just earlier this year, we had attempts in Congress to increase the rigor, the evidentiary requirements of the program. And it's already one of the most rigorous programs in government. You know, the programs have to be proven, their outcomes have to be proven in communities, they have to be proven by randomized controlled trials. And so when we saw that as advocates, we saw no one else is requiring anyone else to prove tax benefits work or farm spending or other spending. And we're caught in sort of this tautology of more evidence, more evidence, more evidence to get more money. And I think we have to step back from that and take a balanced view, because not all programs are going to be evaluated to the highest degree. And it shouldn't be that the programs for children, for poor children, need evidence and nothing else does. So I wanted to echo that, because you sort of get into that trap, which we were happy to you know, follow down that road to get more money, but it seems like to get even more money, they want to increase the bar.
So let me go into maybe a more controversial way of looking at this, but it's that budgets are about trade-offs. And so one of the things that we're talking about, sort of, there's different objectives. The objectives may be because this is one of the richest investments that we can make, and for the long-term health of the economy, this makes a lot of sense. And another objective is this is the right thing to do, and that you want to make an investment. Now, I am the mother of 2 teenagers, and I will tell you, your view of children shifts when you suddenly have teenagers. It's not nearly as sympathetic. I feel like they should maybe go out on their own, but I'm sure that it will return to where I see all the payoffs and the investments. And the values, it's the values. Maybe that's why I've lost the sense of values. Like, really? You're storming up and slamming your door again? But if you go to policy school, like I did also, you know, you do start the whole exercise of what are we trying to accomplish? What are the different ways that we're going to accomplish it? Then let's evaluate it and figure out the best approaches. It is hard, but, and I'm not focusing on the kids community, I'm focused on the whole community of budgeting. We're then going to have to look at our objectives and figure out you can't do everything. You can't make the case that we always need more of everything. We may need a lot more spending on kids and a lot less spending on other demographic groups. We have a lot of spending on seniors compared to children. But usually people don't want to go into the trade-offs part of it, because then it becomes hard. Like, are we really saying $1 is better spent on kids than it is on seniors? Well, I am, but that's not as nice a sort of soft, fuzzy way to talk about how important it is to do these things. So I just think being willing to add the paradigm of how you decide what it is you want to accomplish, what the best program to accomplish it is, and how does it compare to some of the other potential claims on resources is something we will see more in the budget process, is something we should see in the budget process. I think kids will fare really well on both elements, values and investments. And I think that the more we did that now, the more we'd be shifting resources to children. But it is always when you're moving from the policy to the strategy, it's a hard decision of, would you ever acknowledge that there's some places you should spend less on it? Or would you ever say there are other things we should spend less on so we can spend more on kids?
Your comment on your teenage children remind me that it doesn't end. So I have a daughter who's
Really?
still in her 40s, and she still regales the family every year with the story that when we visited colleges together, I constantly embarrassed her because I would ask the question, after the college would say, well, we have this great Nobel Prize winner, and I would ask the question, well, tell me what happens to your typical student or your average student. And she said everybody would turn to her and look at her and say, well, why would your average student want to come to this college? She now teaches colleges, but she still tells the story. So that's my very roundabout way of saying, is it not just a question of how much evidence we provide, but even the types of evidence? So what I find is at the Urban Institute, where we big emphasis here is on evidence-based policy and finding evidence, is I wonder sometimes if we don't have different standards. So for children, don't we sometimes have to prove that we're getting an investment return, they become more productive? Whereas for some, let's talk about other even social programs, it might be, well, they reduced poverty, or they expanded health coverage without regard to whether they improved health. So I wonder sometimes if we don't even have different standards for whether we require evidence, but whether sometimes we don't require many more types of evidence. Programs have to be good at reducing poverty and increasing work and increasing productivity versus, say, just one of those.
Yes.
I think we're going into a spiral. You're absolutely right. Whereas the other programs, I think, are held to a different standard. And children's programs must continually prove that there's no fraud and abuse, ever, that there's evidence behind it, that there's a return on investment, short and long term, and mostly short term because members of Congress, that's their window. And I think, I'm a firm believer in evidence-based policy. Children's problems are way too great not to have programs that are effective. But at the same time, it in many instances becomes an excuse where, okay, we won't fund this or we won't invest in what really works, and we will fund other things. So trade-offs are made and children suffer in those trade-offs.
Is the higher standard, could it be turned to an advantage? In the sense that when you're arguing for the programs?
Go on. I was wondering that when you all were talking, that since these programs are being held to a higher standard, and I assume still doing pretty well. It's like a bunch of programs have jumped through 3 hoops while others have jumped through 1. Is that what you're saying?
I'm not saying that it's working now, but I'm wondering if there's ways to turn the debate around to an advantage for those programs that are trying to provide evidence.
Well, I think you can say those programs should garner more funding, and that's absolutely true, but most programs sit within a continuum of other services. Right? Home visiting sits on a platform of Title V and Medicaid and CHIP and other programs. To the extent where we are arguing that other programs are less worthy and our programs are more worthy, I think that's really dangerous. We should be lifting up all of the programs because children need a range of services. That's where if you found a way to turn it to our advantage, I'd love to hear it. Yeah.
I just add a quick observation that even in programs where there is robust evidence of the outcomes, so programs like CHIP, we're still seeing in this political environment that doesn't necessarily mean that even though they've enjoyed bipartisan support since inception, it was stalled and held up for other reasons. Even though there's a wealth of evidence that this program, it does have great outcomes for children and is effective.
It's a little bit of a jump, but I don't know what to make of this finding, but at one point we did polling to figure out what messaging on fiscal issues would resonate the most with the public. And I just assumed it was children and grandchildren. And I had been in Europe, and there was this fabulous advertising campaign with crying babies saying, "Why are you leaving such a huge debt to us?" And we copied it and used it. I just loved the whole visual of it. It was funny, except not funny, but sort of funny. But the polling showed that it just didn't register. And what I don't usually believe in a ton of polling. I think it absorbs a lot of resources. So we didn't do follow-up polling to understand it more. But what resonated with people on this issue, on the fiscal issue, was the fear of our dependency on borrowing on foreign countries. It was a very clinical response when I had thought it would be the emotional response of your kids and your grandkids. And
across the board for women, men, age groups.
it was I don't remember the crosstabs of it, but it was startlingly true. And I think it was across the board. But it would be worth following up a little bit more on that to understand that, because it seems to me like that should be the most sympathetic argument for a lot of things, and yet our finding was that it wasn't. So digging deeper on that would be useful, I would think.
I know First Focus has done some polling in years ago, which showed that the public, one, thought investments in children were much higher, and two, didn't want the next generation to be worse off. So they wanted investments because they wanted to think their children, their grandchildren were going to do well and do better than they did. I think, and one of the things, I was talking to our executive director, and he was saying how older women support investments in children, and now what we're seeing is younger men, the next generation, support investments, whereas older men supported less investments in children and were more concerned with other spending. So I hope that that continues.
Yeah.
So I'd like to throw one more thing into this. I agree that the numbers, I'm a numbers person, that there are trade-offs, but when you have a budget, there is spending, and then the other half of it is revenues. And no one likes to pay more taxes, but if we want to, I was reading, so as you get more wealthier, as our country is getting wealthier, we could choose to devote a higher percentage of our income, our GDP, to healthcare. That's what people do when they're in their own personal life, when you're in your 20s and you're not spending your money on healthcare, but as you get a little more income, you support your health care. And we could, as a country, decide, okay, we want to be spending this much on Medicare, and we know it's going up like this. We're going to have our revenues go up, and then we wouldn't have as much of a squeeze. So I just want to bring in the two sides of the fiscal picture. Obviously, I can't run for anything now that I've said I would like to see more revenues. But there are better and worse ways to raise revenues, and this is not a tax conversation, but I just don't think we should talk about spending without also acknowledging that there's the revenue side, especially when we see those lines Heather showed, where the revenues are so much lower than, they're so much lower that, we would never want to zero out children's spending, but to bring them together, you can't bring the math, you can't bring them together unless you consider raising revenues as well as a number of other challenging trade-offs.
Julie, I wonder if you might take off from that and address something that's also in the report, which is the different automatic growth paths that certain things are on, both on the revenue and on the spending side. Because sometimes I look at the numbers on children and I think that their squeeze is an accidental byproduct of things that even legislators don't understand. They've got some programs that grow this way, some that grow that way, and they don't even understand how that's all playing out. It includes revenues, of course, but they don't understand those growth paths.
Right. I think those of us that live in DC are getting more and more familiar with the word discretionary spending, and even that non-defense discretionary spending and defense, that there's these big pots of budget, and the defense discretionary spending, Congress has to appropriate every year. So every year they have to vote funding, and a fair number of children's programs are in that area, although the big ones, Medicaid and Earned Income Tax Credit, are not. But WIC and child care and Head Start, they have to fight for money. Sometimes the home visiting program have to fight for money every year, whereas other programs, the entitlements, Social Security and Medicare are the two largest. Medicaid is also large. How much Social Security we pay out is written into law, and so that based on my income. So anyways, it's more automatic, and so that also affects things if something's indexed to inflation. So if we just say SNAP benefits are going to go up with inflation every year, then it's easier then SNAP spending is more going to respond to inflation than like WIC, which is a discretionary. Every year to appropriate and food costs go up, the WIC budget doesn't automatically go up. That's what you're asking me to say. I hope I said it the way. Maybe you want to add something, Gene?
No, I'm just wondering to the extent, I think I know the answer, to the extent to which that's actually having a very direct impact on the projections we have on children, the spending on children.
I think children...
And on the politics as well.
So I think there are enough children's programs like Earned Income Tax Credit and Medicaid that are in that doing better category that's helping children do better than they otherwise would. So I'm not quite going where, there are a fair number of children's programs that are, Medicaid is one of the largest sources of spending on children and Earned Income Tax Credit. So the discretionary pieces of children like education, early education, they're getting very squeezed, but children as a whole are not being squeezed as much because of Medicaid and Earned Income Tax Credits. That's the way I see the math playing out.
There was a period, I believe, where they were the two fastest growing programs. Interest on the debt now is, but there was a period where when people when we talk about entitlement reform and we think about Social Security and you talk about, well, maybe you should make the benefits, bring them down for people who need them less, and then other people are concerned saying, well, if you turn it into more of a program for poor people, there won't be as much support. And I remember looking at it, and the fastest growing programs were EITC and Medicaid, and I found that very reassuring that there actually was a lot of support for programs that were means tested, not just those that were universal. And that goes to a broader discussion of, is it going to be smarter to have programs that are targeted towards the people who you want because you can get more resources to them, or universal because it builds a broader constituency? And my concern about the universal portion is that you're just paying a lot of money to people you would want less to build the political support for it. It would be better to divert those resources to the people you want. But I thought it was encouraging that period when those were the fastest growing programs. It is not the case anymore.
It's less the case now.
It certainly is. The other thing that you were saying, you were talking about these lines, right? And spending and revenue. That's a chart, it's a graph. And it is true, they are growing much, much larger. Both revenue and spending are projected going forward to be higher than their historical norms, spending by much, much more. And there is without question going to be a pushback to the notion that I think you have to do this on the revenue side and the spending side. There's no way to fix the problem. But I think where you're going to have pushback is on the idea that you should raise revenues in order to raise spending higher on net. Now, I would have also said we shouldn't have done what we just did, which was cut revenues. That was stupid and crazy and incredibly irresponsible. There's better words than stupid and crazy. It was really irresponsible. But I do think on net, it's going to be hard to make a case that spending should grow more than it's already growing. And so that's why I think, because it's projected to grow significantly higher and above its historical averages. That's why I think on net, there will have to be offsets for new spending from other spending reductions. I just think there'll be a limit of what the political environment is willing to absorb for growth in overall spending.
You also raised the issue, which I had not, about universal versus means-tested programs. So to what extent should programs for children be means-tested versus universal? Or we just want to get the right balance?
I think target everything where you can. I'd rather have the resources where they're most needed.
So I look at the school lunch program sometimes where you try to get both. Everyone gets access to school lunch, and it's kind of and those that are low income get more of a subsidy, but everyone gets whether they know it or not. Everyone who buys lunch in school is getting a subsidized lunch, and so I think that's the one way to do it, is make it universal, but make the parents are paying for a chunk of the school lunch, and the government's paying for a chunk, and then for the reduced price, it's the parents are paying a smaller amount, and then there are some kids who are getting it free. So you can structure programs that have a universal aspect and target more resources to lower income kids.
So I'm not against means testing. I think you need to target the resources. We have a scarcity, but I think it needs to be a glide path where if parents are starting to get more economic stability, that the rug isn't pulled from under them and they're no longer eligible for programs.
Those cliffs are
Exactly.
terrible incentive.
That's exactly
and terrible for transitioning people into new economic environments. Yeah.
Right. Actually, Karen made a point I was going to make.
Okay, so I'm going to ask the last question of you before I go to the audience.
It's not to have you answer your own questions, Jean. I want to know what you would say.
Huh?
I want to know what you would say.
I've got to play the role of moderator. Right? This is your show. So I'm going to ask you a last question. And actually, some of my questions were leading, so come on, I got some points in. And then we're going to go to the audience, but just so you know, at the end, I'm going to ask you to provide a summary of what you think the audience needs to know most. But you can hold off for that. That'll be right at the end. So my last question before we go to the audience is, I wonder if you might want to connect, and I'm going to go back to what's going on generally in politics in general and with legislation. Do you see any connection between our seeming inability to tackle many of these children's issues with our wider inability to address other problems in society? Are there some common causes that we need to think closely about if we're going to deal with this issue of having adequate investment in children?
So I think this political environment to me feels very different. It's unprecedented. It's more partisan than it's ever been. And I think it will continue with the Supreme Court nomination, with immigration, with all kinds of issues going on in Congress. When you look at children and our inability to break through, and every year we talk about the disinvestment in children, it feels to me, it reminds me of our lack of a national conversation along race and the issues that we have in this country, and divisions along racial lines. A good percentage of the children we are talking about are children of color. And the public is really divided over many, many issues. And it seems to me that children sometimes are very much collateral damage. And unless we have a discussion on inequality and systemic inequities and opportunities, I don't think that we're going to break through on children. That's just my feeling. I liken the two together.
That's a very deep and discouraging thought. If it really is reflective of a racial bias, that is kind of a crushing statement, and sounded like it may have some truth to it. So I was just thinking through what you said. That's discouraging. I was discouraged by my points, and now more discouraged. But mine, I think it reflects a bunch of things, some of which I mentioned already, but we focus on the short term more than the long term. We focus on the political more than the economic. We focus on consumption more than investment. And I think we focus on economic security for people who need it less rather than economic opportunity for people who need it more. And those things are so backwards in so many ways. And I spent so many years doing public policy and believing that the kind of right, sensible ideas will float to the top and they'll be fact-based and that's how we'll get to the right decisions. And for a long time, it did feel like it worked that way, and it doesn't now. So thinking that those frames are so backwards and obviously we'll come to our senses and fix it, I don't have the same trust in that I used to, and that's really scary.
I think I'll have to echo what Karen had mentioned, was that a lot of this data, the state of our community, it's not new to us. We know that these are long-standing, persistent inequities along racial and ethnic lines that we continue to see. Despite progress, we see those differences growing. If you look at the wealth gap, that grew by 14% between 2013 and 2016 between Latinos and white families, even as we're seeing better outcomes, better incomes, lower unemployment. And so we're constantly wrestling with that, what needs to change and get around this paradox. I think, unfortunately, a lot of it that we're seeing is this toxic environment that is making those things worse, more division, less our members of Congress being less amenable to coming together around common values. CHIP reauthorization should not have been a problem. I mean, there were tens of thousands of kids across the country whose health care was in jeopardy because states were running out of money, just because a long supported program could not get that support because of congressional dysfunction. But unfortunately, I think there is a lot along racial and ethnic lines and biases in this country that I'm just not sure when we can get to that day of reckoning and make things right, and recognize that these are problems that affect all children across the board. I was glad to see that a lot of the programs are targeted to low-income kids, but a lot of times that's code for communities of color, and that doesn't always have the same galvanization of support.
Samantha, you mentioned the dehumanization of children. I actually think it starts with, I don't think folks think, oh, I want to harm children. I think policymakers think, I don't like your parents. I don't like their values. They need to work harder. And so children are wrapped up into that because they are, they become collateral damage. And I do think, we need to have a discussion on what it means to be poor and lack of opportunities, because by and large, poor people work the hardest of probably any segment in the population. And that story needs to be told. And we need to lift up the perseverance of lower income families and what they struggle with, because I think that there is misconceptions about them, that they are lazy, they shouldn't be here, they are taking money from others, they're, that sort of thing.
Can I jump in with a moderator question now in your model? But following up on that, I am interested because you said work requirements were bad, and I'm not there. I'm intrigued with the notion of work requirements, and I think that they may be a good thing, and I think they may actually increase the support for a lot of programs. But I wondered if you guys could wait, if I could the words.
So certainly a hot topic today.
But I'm really curious what people think about work requirements.
How about a quick answer to this? I do want to get to the audience questions.
Yeah, sure, sorry.
So quick answer to this. But it's a very
So
hot topic today.
I'll say something quickly. Just the ones I'm more familiar with is the SNAP work requirements. And I'm just familiar with the CBO estimate that you would be spending, thinking about to say millions or billions more on monitoring, and you'd be cutting a lot of people's benefits. And that people already are working. So in the SNAP program, it seems to me the work requirements are, if 80% of people are either working currently, were working a year before they got benefits, or are working a year after they got benefits, they are working poor. So 20% are not, but 80% were. And so to put this huge bureaucracy that people would not be able to fulfill, and you'd be paying people to track them instead of paying the SNAP benefits, I do think
it's not worth the cost of the administrative burden.
I don't know
because
what
they're
your
already
solution is
working.
solving.
So 80%
What are you
of
solving?
them are
It's a
already
problem.
working.
Yeah, it's a solution
Well, I think
without
that's
a
sort of
problem.
what I saw, because I saw the numbers and I thought, oh, well, if it's not going to change that much, then what you'd be solving is the perception that you were just talking about, that there's not a work ethic. If there is a really good work ethic from the numbers I saw.
If you did a work requirement that didn't cost so much to administer, and that wouldn't be a work requirement, that would be a lifting up the work people are already doing somehow. If you could do that, let people know that most people on SNAP either worked in the last year, are working now, or work a year after they got SNAP. If everybody knew that, that would be good. Maybe with the data, but telling people to read a SIP report is not really going to work.
It is the large part of this messaging campaign in trying to smear these programs that help working families and help support kids, adding this element of, this welfare, and that it's not deserved and people aren't working. Well, that's not what the data shows. That's not what we see in the communities. And so how do we help educate on that and show really what does lift people out of poverty who are already working, and changing that narrative of what poverty in the 21st century looks like, when a lot of
when I
these
said
people are
80%, I wasn't counting children and I wasn't counting elderly. Probably wasn't counting.
No, if you include caring for children and elderly, I think it's 90% for the more
already
macro numbers.
working. So it's
Yeah, so if you include
they're already
that,
working.
getting education, caring for your kids, or caring for your parents would fulfill work requirements, it's really high. So I think I agree that the point, I didn't think of work requirements as bad, because I thought, actually, if you had them, you'd show all these people are working, and that would be good PR.
If you were writing them, maybe. But if the people writing them, you have to look
you
at
think the intentions are bad.
I do.
I can't remember what state there was a work requirement imposed, and there was a carve out for counties and rural areas that had, there was work in the state, but in that county, there was no work. But there wasn't a similar carve out for the urban areas. I want to say Michigan as well. And so it really was racially tinged in that they were looking to benefit one population and not the other. I think when you have these requirements where you're drug testing people who are getting benefits, and you're requiring work, and you have all these other impediments, when others get tax benefits with nothing attached to it, it really sets up, right, a paradigm that you're unworthy, and it's a small amount of money that you're paying, And we want to make sure, because we don't trust your values. You don't work, you're on drugs, and so that type of spending and atmosphere really does victimize the poor and hurt children.
So this is a great discussion, and if you can probably sneak in another comment when we get questions from the audience as well on this.
Well, there's still some other moderators who
But I'm
haven't
going
had
to
their
turn to the
chance.
audience.
You can moderate.
So we ask you to identify yourself. Make it a question. You can begin it with a statement, but not a long statement. And the French phrase "n'est-ce pas" does not qualify as a question. And then "is it not so" does not qualify as a question. So please, a question for the audience to which they can respond. We have a question over here.
Hi, thank you so much. I'm looking at this project with a lot of envy. I work on the foreign assistance side, and I'm currently working with a project at the moment through the Elevate Children Funders Group to get a sense of how much the U.S. government is spending overseas to support global children and youth issues, and it's a difficult scrub, to say the least. So kudos on this. It's a great model for us. I wanted to ask what you're doing, if you have any examples of what's happening to help close the gap between what experts like yourselves and those in the room know and what the public understands in terms of this. Is there any effort coincided with this to kind of shrink that gap? Because there is quite a big one.
I know during the election, the last election cycle, there was a children's advocacy organization that was purposefully in key states, Iowa and battleground states, really putting people in the coffee klatches, the town halls, the others where the candidates are, and asking them questions about children and trying to educate them about early childhood supports and what children and families need in those states and national policy, to try to infuse children into the dialogue in the presidential election. So I know that was done. In terms of a public policy education campaign, so people know that we do not spend nearly as much as we can and should on children, I don't think that exists. And if there is a funder that can fund that, that would be great.
I will say at Unidos US, in a lot of our work, in our advocacy work, there is a public education, community engagement role. We find that is tremendously successful way to get our community engaged, to make their voices heard, and to just talk about what's happening in their community. We're on the Hill often, but the members of Congress, they'd rather hear from people in their districts. And those stories are such a richness and power in those stories of how something like the federal budget affects communities. So we work with leaders in communities in key states, tax reform. I had no idea there would be such an eagerness from our advocates in the states to come learn about tax reform, what it means for the federal budget, what it means for communities. And those people were some of our strongest advocates in making their voice heard and writing op-eds and just getting out and educating the rest of their community, to where the point where we were polling afterwards to just really learn more about what our community knows about the federal budget and coming cuts and benefits cuts. They're fairly well informed and really see the connections and see how it affects communities. So there is a tremendous need for community activity. We are parts of several coalitions on federal budget and tax, things that a lot of other civil rights and advocacy groups aren't in, and we're trying to help raise that perspective.
I guess I'll just say from an urban perspective, we're not doing the advocacy work, but we're trying to make our findings user-friendly so that those who are doing that work can use them in this, trying to get public spending in 5 charts in case you don't want to read 25 charts, because we sort of feel like if we can get the information in a way that's digestible to folks who are doing the work in the communities, that's our role. And I believe we put on this year, we on our website, Carrie, who's in the audience there, put on a Excel so you can download some of the graphs and things to make them more accessible to people. More accessible to people like you. I think the person in the street isn't going to download our charts.
And I'm sure the people on the panel will be glad to respond to further questions, how to access data, other things like that afterwards, if you don't get the full answer to your question right now. Other questions?
As someone who wants to go into evidence-based policy research, would you have any recommendations of like the greatest areas of need for future research, and even recommendations on how we're designing that research to make it more accessible or more appealing to people that are kind of on the fence about increasing child welfare spending, like reframing it around a macroeconomic context or like ROI?
I think the name of the game is going to be there needs to be a comprehensive economic growth plan for this country. Once we realize that we're stuck in growth that is probably below 2% or hovering around 2% for a while, there's going to be a real panic because there's enough tension as it is about how to deploy these resources. Once we realize they're not growing the way they have before, it's going to be tough. And I think that being able to build something that says, you can get this much return by this much return by this much return by this, and have an apples to apples kind of comparison. I just sort of did a survey of what's out there, and there's not a way to do that yet. I think that will build something that's very policy friendly and very useful. And I would also put in the different time horizons, like we were talking about in the beginning, that something like this would be much good for sustained growth rather than immediate growth.
So the National Academies of Science is preparing a report now on child poverty, what it costs our nation, what are the evidence-based strategies to cut child poverty in half by 10 years. And we're really looking forward to that report because we know First Focus has a child poverty action group. We have sponsored and helped introduce legislation similar to what the UK did to cut poverty. And I'm really interested on the impact of child poverty long-term on this nation, on our human capital, on our ability, our economic security. And so I would say, because I think child poverty is one of the greatest threats that we have to our nation, I would really, I'd say in that area is ripe for research, particularly how it impacts macro, as we were talking about.
Let me just reinforce the access to various data at the National Academies. There's a lot on various cost-benefit analysis, other types of analysis. I chaired a panel on the use of economic evidence to inform investments in children, which is closely related. But there are a number of other studies along those lines. I highly recommend you go to a number of those. Reinforce what Karen said. Other questions? Over here.
Thanks for this report and this discussion. I was just wondering, this report with the focus on the share of the overall budget seems to put a lot of sort of pit the children's programs versus Social Security and Medicare, which might not actually make sense in families' lives if you have a parent who's worried about caring for their elderly grandparent and also their child, if that elderly parent loses out on their Social Security and Medicare, they will have less resources. The mom will have less resources to devote to their child. So I was wondering if, as the large tax cuts for the wealthy play out in coming years in FY18 and beyond, and as we see the impact of state tax cuts on spending available for education, you're going to, in future years, provide more, also compare, in addition to as an overall share of the budget, also to the tax losses.
Well, I can try to answer. So we look at a couple different ways. We look at it 3 different ways, which is probably too many for messaging, but we're trying to get all the information out there. And one is just that, the dollars. And one is the percent of the federal budget. And the third is the percent of GDP, the share of the economy. So we use all 3 of those. As to why the other thing we do is if I tell you we spend $13,700 per child, people are like, okay, is that a lot or a little? And so knowing that we spend $30,500 per elderly person just gives, if you just give the number and don't show for any other age group, it's hard for people to know how to interpret that information.
I have a question.
I think I will add that that first chart that Heather put up, where the share of spending, it's hard not to talk about spending on the elderly when 45% of the budget is spent on the adult share of Medicaid, Medicare, and Social Security. It's like, so 45% of the budget is a lot, right? And so how can you talk about the 9% on kids and not talk about the 45% on it's not all elderly, because there's disabled and then some parents get Medicaid. So I'm familiar with this criticism, and I guess I stand by come back to the numbers. You have to look at where the big spending is.
I have a question from a viewer who apparently did read the report. Give him credit. He said he was surprised, or he or she was surprised, that housing makes up such a small share of investment in children, and wants to know what the research says on the return on investments in stable, affordable housing, and do we see any opportunities to do more? Anyone want to comment on housing in this context and how important it may or may not be for children's investment?
I mean, I think the reason it's small is because it's one of those discretionary programs, and so you have to fight for it each year, and it's not entitlement. There are a lot of people who would like to have access to housing and don't have it. So I can say more about why it is small, and just to be clear, we aren't talking about all housing, we're talking about the share of housing that goes to children.
Although, again, looking at the recent CEA report, that Council of Economic Advisors report, it does clearly lay out, as does this report, the decline in investment in housing relative to other types of investment or just social welfare spending over time.
I mean, housing insecurity is a huge issue for children. We know homelessness is on the rise. If you don't have a home, it seems like a no-brainer that more investments need to go in stable housing for children. I'll leave it at that.
So we're going to have a last question here, and then we're going to go back, as I say, to our panel for
I would definitely like to argue that there should be an additional chart without Social Security and Medicare. And the reason is simple. These programs are financed separately, and they are different. People pay into their retirement, people get back from retirement. This is no investment into anybody, this is no paying into anything. So there should be two charts. One with Social Security, just for the purposes of illustrating where it goes, and the other one on how actually we divide the money that is not separately allocated to the retirement. And the other thing, just a question. What is the percentage of children, how is it supposed to change over a 10-year period? The percentage of children in population.
It's declining, as a percent of population, the percent of children is declining slightly. I can't do it without finding in the book, it's like 24% to 23%, but don't quote me.
Do you want to respond to the comment about...
We also want, you told us we had, because there's something I forgot to say, that we had closing comments, so I want to get to those, Jean. I'm not going to explain why CBO uses a unified budget and why we follow that.
Okay. So, you want to address that in the last closing comments as well. And anyone could start?
Start. I'm going to use this to be my note of hope. I think everyone else has tried to be hopeful at one point. I am hopeful, just having this conversation is taking part, that groups like Urban is doing, this work to help shed some light on what's going on. I think the variety of people in this room, on this panel, really shows that there are people from a wide variety of stakeholders who are invested to really changing the narrative and what the investments are in our children. So I'm hopeful that that the researchers, that the policy experts, that the advocates, that our philanthropic partners can really galvanize around this issue and just really work to elevate the data, evidence, if you will, of what we know works and what we need to do, not only to have a robust economy in the future, but also to lead with our values as a nation.
I don't know if I have a takeaway other than the report, but the thing I wanted to say earlier, and I forgot to mention, is that actually, so this comes out this week. I think it's in 2 weeks. We're still, we've done a second analysis, which is looking at how the 10-year spending trends would change if the president's budget were fully adopted. President's budgets are never fully adopted, but still it's useful to know how things would change. And so that report will be coming out certainly within 2 weeks. So stay tuned to the same webpage on Urban where you found this.
I'll just close with saying thanks. It's an excellent report. The work that your groups do are all really, really important work. And nice panel. Thank you.
I would encourage folks in the room to really hold elected officials, both on the state and federal level, accountable, to raise up children at every opportunity, to inform them about what's in First Focus's budget book, this Kid Share, and other projections and analysis of the spending, and support legislation that is really going to turn the tide and make investments in children that we need to be made and tie it to our future and our economic security. So I'll leave it at that.
All right. Let's give a round of applause
Thanks,
to our
Jean.
excellent panel.